Okay, I think we're ready to rock and roll. All right, everyone, it is about 6 o'clock and we want to be sensitive with your time. So I'm gonna go ahead and get started. I'm Jacqueline Jackson. I am our Senior Marketing Manager. We're so thankful that you are here with us tonight. So I will go over some quick logistics, just so you know. The restrooms are just outside the double doors to your left. One note, the building doors lock at 6:30. So if you're thinking right now, I forgot my cell phone, I need to go take a call, I need to grab something from my car, just let one of the center staff members know so that you don't get locked out of it. Okay. And then the last thing, we have some handouts in front of you. There are a lot of good resources in there. What I do want to call to your attention is that there is a survey in there. We want to make sure that this is a presentation that brings value to you. So please, if you wouldn't mind, take 2 to 3 minutes to fill that out. Thank you. All right, so now I'm going to pivot to introductions. Most of you all are very familiar with the center, but for new faces in the room, we definitely welcome you, and I'd like to let you know a little bit about the center. So we've been around for about 40 years. Let me see if I can. I know you guys probably don't want to see my face the whole time. Let me see if I can move this down a bit. So we've been around since 1985, and if you do the math next year, that makes 40 years. So we basically, sorry guys, I lost my train of thought for a second there. But okay, we've been around for about 40 years. We have a robust team of about 30 members. We manage about $1.6 billion in assets, and we work with just around 2,000 individuals and families. That is the center in a nutshell. But even with all of these accolades, I want to emphasize that the thing that we care about the most is our mission statement. And so I've written it down here. Striving to improve lives through financial planning done right. That is incredibly important to us, and we hope tonight that the integrity of that mission statement is maintained. You guys can let us know in this survey if it's not. 2 seconds here. Oh, do we have a little freeze here? All right. If you want to be fussy, let's try it this way. I walked you all through our quick announcements. Okay, now the fun part. And Sandy's over here a little embarrassed, but I love your picture, Sandy. Those are very friendly. I always love showing, snipping Sandy's accolades on the website because they are so vast, and I think she works very hard, and it's definitely worth showing off. But I want to tell you a bit about our event coordinator today, Sandy Adams. She is our longevity and elder care specialist. Among other things, you guys can clearly see the huge list of things going on, but Sandy is a certified financial planner. You can't tell by looking at her, but she has 30 years of industry experience. She has her master's degree in gerontology, which emphasizes that elder care component of her role. And then also she leads several, as you can see here, several boards, and among others, she's the president of the Michigan PA. So very accomplished woman, very well-connected woman, and I'll let her speak a bit about that in a couple of minutes. Sandy, your face, you're like, calm down, calm down. But no, you definitely deserve the accolades that I'm giving here. So with no further ado, I will turn it over to Sandy Adams.
So this isn't really about me. This is about the resources that we provide. So as being a client of the center, we like to have a holistic approach. And part of that is providing you resources for all parts of your planning. And so tonight we're talking about pre-retirement. And a big component of that is what do I do for insurance, right? And that scares a lot of people, right? So much so that a lot of people say, I'm just gonna work until I'm 65 because I don't even want to deal with that topic, right?
Right, oh, absolutely.
You get that a lot,
Absolutely.
Cynthia and Jennifer. So we like to have professional resources that help guide us. We'll be honest, and many of you that are clients of the center will attest to this, that we know enough to be dangerous in the insurance area when it comes to insurance and Medicare. We can tell you the basics, but we're not experts. So that is why we have professional partners that we can have available to us, that we can send you to, and we collaborate with in these areas. That deal with us day in, day out, that's all they do. So that as things change, which is like annually.
Yeah.
Unfortunately, every year it's different. There's new rules, plans change,
Prices change.
prices change. Every year, that's why we do these sessions annually, because every year there's gonna be something that's different than last year. That you can sit down with someone and go through your plan to make sure you're always on the right path. And then there's some reasons to collaborate between your planner and the partner that you're working with for your insurance. In the pre-retirement area, there are many of you where it might make sense to intentionally keep your income lower in your pre-retirement years so that you can qualify for subsidies. Some of you that might not be an option, but for some of you it is, and we can work with you to determine what sources of income, what accounts we might be drawing from to fund your income needs in those pre-retirement years so that you're eligible for these subsidies. And then once you get to Medicare, the income thresholds for Medicare are much broader. So we don't have to be as tight with your income. So there's reasons for us to collaborate with people like Cynthia in order to get you the best plan possible, to have the lowest premiums possible, and that can change from year to year. So this is just part of what we do, but it's much more complicated when you get into retirement, when it should be the exact opposite. In many of the areas as you age, things should be simpler. They're not, they get more complicated. Exact opposite of how it should be. But with that, I'm going to go ahead and introduce our guest speaker, Cynthia Brown from Powers Financial. I don't even know how many years we've been working with you, but
I think it's been about 7 or 8.
and
Definitely 7.
we get nothing but rave reviews for anyone who works with Cynthia. And I'll let her explain kind of how she works with clients. But here today, she's here to just kind of go over pre-retirement healthcare, how it works, changes for this year. And if you have questions, preferably if you wait till the end, if you have an urgent question, you can't wait to ask. I'm sure she'll take some during the presentation, but if you can wait, that'd be great if you could wait till the end.
Thank you very much, Sandy. And I brought my colleague here, Jennifer Rayom, with me. So she started working with me back in April. And she's been just fantastic. So if you ever talk to Jennifer, you'll know the face that goes with that voice. Right. So yeah, Sandy said, health insurance pre-retirement is such an important piece of the picture. Especially now. I mean, I started this business 29 years ago. And I remember when a family of 5 could get an individual health insurance plan with maybe a $250 deductible, $3 drug card, for $400 or $500 a month, family of 5. Now, one person can't get that coverage, for just a single person. And we're usually looking at deductibles that are much higher than 500 now. So it's really changed a lot, over my career. When the Affordable Care Act came about in 2014, that added a whole nother option for people. Prior to that, individual plans were medically underwritten. So carriers could decide whether or not they wanted to take you. So that piece has gone away. There's no more, because I still get that question a lot. Is there any, pre-existing condition concerns on the individual plans? So there's no medical questions. You can change, you know, if you're on an individual plan from 1 year to the next, to a different carrier, a different plan. So that piece of it has gotten a lot better, but with that, we've also seen prices go up a lot. So as Andy said, there are sometimes some strategies that can be employed to help, you know, minimize the cost of what you're paying for the insurance by pulling money out of different buckets, you know, qualified versus non-qualified. So I'll show you some examples of that as we go. I'm curious though, survey for you guys. Are any of you already on individual under 65 plans? Okay. What, maybe? No, okay. That just kind of helps me know, you know, how to really gear this. So let's just jump in and I'm gonna use that one. So there's two ways that you can go about your individual health insurance once you get to the point in time where you need to procure that. One way is through, it's called the marketplace. Some people call it healthcare.gov. Some people call it Obamacare. That's one pathway to get your insurance. The other pathway is just going direct to the carrier. So you don't have to go through the marketplace. Now, the reason to go through the marketplace is if you might be subsidy eligible, where you can get premium reductions on plans, and that is income-based. We will look at examples of that. Because if you don't go through the marketplace, you can't get subsidies. So that's the only way. And sometimes people are, I don't know if I'm going to qualify for a subsidy. I'm not sure. Because when you're doing this and you're projecting your income, so let's say you're enrolling for 2025, you have to estimate now in 2024 what your 2025 income is going to be. So sometimes people aren't sure. They think they might be subsidy eligible, but they're kind of borderline. For them, it's a good idea to enroll through the marketplace so that if they did become subsidy eligible, they can capture those. But the reason to not enroll through the marketplace is if there's no way that you're eligible for a subsidy, you just can't hit that income in a range that qualifies you. It is definitely a much simpler process enrolling off marketplace, and you don't get like 5 million emails every fall from the marketplace telling you need to review your plan. And but again, if there's any chance somebody's eligible for subsidy, you definitely want to enroll through the marketplace. And the marketplace is basically just an online, I guess, insurance shopping experience, you know, where you can look online at plans. And I'm going to show you that and show you some of the areas to be careful about if you're doing it on your own, driving the bus. I've got some horror stories of people that kind of did some things they didn't intend to do, and it's sometimes hard to undo those things. So I'm going to give you some cautions, but let's go ahead. And basically, to be eligible for a marketplace plan, you have to live in the U.S. You have to either be a U.S. citizen, U.S. national, or lawfully present immigrant for the entire time you plan to have the coverage. Can't be incarcerated, okay? And they asked that question on the app a few times if you are in jail. So they're going to make sure. There are 4 what we call levels of coverage. So they're called metal levels. And I will tell you that the bronze level, which has an actuarial value of paying 60% of your healthcare costs, bronze are the most popular plans. Okay. Silver is an important metal level if your income not only qualifies you for a subsidy, but for deductible reduction. So this is gonna make more sense as we go, but silver can be an important category for certain people in certain income ranges. I don't think there's very many people on gold plans, and I have not seen any platinum plans offered in Michigan for a while. So, but basically, the higher the metal level, the less you pay out of pocket for your medical care, but obviously, the more you're gonna pay a premium. Okay, so most people have gone bronze just because of the price point. Head here. There are, okay. Anybody in here have kids that are 30 and under that you're, okay. So there are catastrophic plans that are just for people that are under 30. They're priced a little more attractively for those 30-year-olds. Under 30-year-olds, and they still have a very high deductible. I mean, this year it's $9,400. And they have to include at least 3 primary care visits per year covered before deductible. and certain preventive care, but they're called catastrophic plans. They still have the same coverages that any of the other individual plans have because the Affordable Care Act, they mandated certain benefits. So as far as what's covered, all plans are pretty much the same. It's just what is covered before deductible. What are your co-pays? So and we'll explore some of those down the road here. But these are the essential health benefits that all plans have to now cover. They're known as reform plans. There are some people in Michigan that still have pre-reform plans prior to the Affordable Care Act that don't necessarily have all these benefits included. But since you guys aren't on individual plans, and if you are going to go on them someday, as of right now, these are the essential health benefits. So we've got your doctor's clinic visits, emergency services like ER and urgent care, hospitalization, maternity and newborn, mental health and substance abuse, prescription drugs, rehab services, labs, preventive care, and pediatric services. So prior to the Affordable Care Act, sometimes people would carve out prescription coverage. They didn't take scripts, they didn't need it. So they could reduce the premium by carving out certain benefits. Or maternity. I mean, if you're 50 years old, you probably don't need maternity. So now you can't carve those out anymore. So they're building those into every policy. So people that are no longer childbearing age, even males are, figuring into those rates. Now, here's the thing. These are essential health benefits, but with a lot of plans, the deductible is so high, you may never get to use them. And I guess that's a good thing if you're not, having serious health conditions. But the one thing that has to be covered before deductible on every plan is preventive care. So that's things like your annual physical, mammograms, pap smears, colonoscopies are iffy. So I always tell people if they're getting close to Medicare and they can wait for that colonoscopy, obviously don't wait if there's something going on. Because on the under 65 plans, you may go in thinking, okay, I'm not going to pay anything for this. It's going to be covered 100%. But lo and behold, if they find a polyp or polyps and remove them, now it's no longer preventive care. And now it's going to be subject to your plan deductible. So people are often surprised to get that couple $1,000 bill for that colonoscopy that they thought, was going to be covered 100%. So it just depends on when they go in, if it's clean or if they have to, remove some polyps. So that's sometimes, like I said, if someone's approaching Medicare, you just might want to wait till you get there for that particular test, because even if they find a polyp under Medicare, you're going to have a lot less out of pocket. So along here, any questions? I know I'm supposed to wait till the end, so never mind. So subsidies may be available to lower the cost of these super high premiums for certain households who aren't eligible for other coverage. So we'll get this question sometimes. Well, I have an employer plan, but it's costing me this amount of money. I'd rather go on the marketplace and get a subsidy. Well, if you're eligible for an employer plan, usually you are not eligible for a subsidy because the percentage of what you pay out of your paycheck for that employer plan, and I don't have the exact number in my head right now, but it's got to be like more than 9% of your income. So most people don't end up qualifying for subsidies that have employer coverage. It's pretty rare. But if you're eligible for Medicare, you're not eligible for subsidies. And once in a while, we'll get somebody that's approaching Medicare and they're getting a very big subsidy on their under 65 plan. And maybe they're getting the deductible reduction because they're keeping that income and they don't want to let it go because they're like, I'm going to pay more when I go on Medicare. So you can't do that. If you do, they're not going to give you the subsidy anymore and your coverage is not going to work very well. So when you get to 65, you definitely need to get off the, marketplace plan. Yeah, off the marketplace and onto Medicare. But yes, if you're eligible for Medicaid, and this is an area I said sometimes people do things online on healthcare.gov and get in trouble. But if you're eligible for Medicaid, you're not eligible for a premium tax credit. And what some people have done is they'll go on healthcare.gov and they'll unknowingly start an application when they're really just wanting to look at plans and prices. And sometimes people when it came to the income question, they're like, well, I don't want to fill that out right now. I'm just going to leave that income question blank. And then they go to see their results. And what it's done is it's actually submitted an application with the marketplace and the marketplace says, oh, you're eligible for Medicaid. And it sends them automatically to the state Medicaid department. So I can't tell you how many times we've had someone call saying, I just got, this Medicaid letter in the mail. I don't think I qualify. And it's like, were you on healthcare.gov? Uh-huh. Did you put through an application? Well, I didn't think so. And so, mistakes happen, and it's kind of hard to unravel that, when it's a government, you put something through, it can be hard to then unravel that. And so be careful. And I'm going to show you how to look at plans without actually starting an application. But things changed back in 2021 with the passage. It was called the American Rescue Act. So it was like kind of second year of COVID. It used to be that people that qualify for subsidies had to fall between the 100% and 400% of federal poverty level. And man, if you hit that 400%, the subsidy went from here down here. It was called the subsidy cliff. But what they did as part of the Inflation Reduction Act is they expanded subsidy eligibility. And so sometimes now even people that are over 400% of the federal poverty level are still qualifying. And it's a gradual decrease of subsidy instead of just like, here you have one, here you don't. So that's better. However, this is part of that Rescue Act. It's right now good through 2025. So people enrolling right now for 2025 still have access to the expanded subsidies. We don't know if it's going to continue after this. It could depend on the election, which way this goes. But there was a temporary expansion. So we will have to wait and see, but they're still in place now. And what they base those premium tax credits on, and Sandy was kind of alluding to a little bit of this, is they look at your modified adjusted gross income. And again, you're retiring for 2025 and you're enrolling in a plan, you have to guess, you have to estimate as close as possible what you believe that's going to be. But how they define modified adjusted gross income is they take your adjusted gross income, which is line 11, on your tax return, and then they add in, a lot of people don't have some of these, but untaxed foreign income, the non-taxable Social Security benefits, and tax exempt interest. And they're looking at the entire household income. So let's say you have a spouse that's already on Medicare and you're under 65, and that spouse is collecting Social Security or taking out a retirement account. Even though they're not enrolling in a plan, they still look at the entire household income. So that catches some people surprised. They're like, why? Only one person is enrolling, but they're looking at that entire, financial picture. So because it's really hard to 100% predict your income for next year, the market fluctuations, if you work on commission, whatever the reason, it can be hard to know exactly. So how they handle that is when you're filling out a marketplace application, putting in your income, they are going to compare the income you put on that application with your tax return for that year. So if you said, okay, next year I'm going to be at 50,000, 2025, and then lo and behold, you ended up at 60,000. When you file your 2025 return, there's going to be a reconciliation that's going to take place. And because you made more than you said, you're going to owe back the difference between the subsidy that you would have actually been eligible for at 60,000 versus what they gave you at 50,000. So there is a reconciliation that takes place. There's no penalty. There's no interest. It's just a matter of, making it right. On the other hand, if you said you were going to make 60 and you only made 50, they're going to give you money back when you file your tax return. So again, it's just going to adjust it to what the subsidy should have been. So there's always that day of reconciliation that takes place. They do allow you, let's say the year's going by and you said one number, and in June you realize, okay, it's going to be a lot more than I thought or a lot less. You can always adjust your income throughout the year, and then they adjust your premium at that point. So that could be helpful if somebody thinks they're going to owe a lot back, to kind of stop the bleeding at the point in time they know that. So that they have less to pay, back when the time comes to file that tax return. I think I pretty much covered that. So this is another interesting area. I talked about some people qualify for premium tax credits or subsidies. So that's just the amount that the normal premium is reduced by based on your income. Some people, if the income is low enough, also qualify for, it's called cost sharing reductions. So a plan that might normally have a $5,000 deductible, sometimes we've seen those reduced down to even $900. And an out-of-pocket max of 9,000 might be reduced down to 2,000. Co-pays that might normally be, you know, 50 bucks at the primary, 100 bucks at the specialist might be, we've seen 10 and 20, you know, so there's definitely a very sweet spot there where some people can take advantage not only of subsidies, but also of those cost sharing reductions. And you have to be between 100 and 250% of the federal poverty level to qualify for that additional, you know, cost reduction. And that's why I mentioned silver plans in the beginning. You have to enroll in a silver plan to get that. So we will look at some of those in a minute. I think a lot of this is going to make more sense when I actually log into healthcare.gov and show you some examples of some different things. Oh, guess what? We're going to do it right now. So if I can make this work here. Did Jacqueline? Oh, she left. I got here. I might not get back. Oh, I think I can actually just click that. So if you go to www.healthcare.gov, this is the official site. You usually see smiling people on the front. They change the people from time to time. But you do want to make sure there's also going to be that flag, American flag, stating that this is an official site. Because sometimes people will go in and Google healthcare.gov, and then they get all these different, you know, options. So I always say, don't Google it, go into a browser and type healthcare.gov. But the way that they've actually have this laid out a little nicer recently, and they've made this more obvious. But over here, you can browse plans and costs without getting in any trouble, okay? You actually apply for coverage. That's where you might end up with some issues. But this used to be a little more hidden, a little harder to find. So I like that they've got it, you know, much more visible. All right, so you start here, see plans and prices. We can't look at 2025 yet. They have not loaded. So we're just gonna have to look at 2024. And anybody want me to put in a particular zip code? All right, I'll just pick one. All right, 48098. And then you just confirm Oakland County, continue. All right, so step 2, tell us about your household. So let's do you and other people. And again, they want to know about everybody in your household, not necessarily, you know, and it even says that your household includes you, your spouse, if you're married, and everyone you'll claim as a dependent on your tax return, even if they don't need coverage. All right, but we're just gonna do a husband and wife here. And it's, are you married? Yes. And if you are getting a subsidy and you're married, you have to file a joint tax return. So even if that marriage takes, I don't know how the tax rules work, but even if it happened December 31st, you'd still need to file a joint tax return. So that is one of the things that you have to promise to do. And then we're going to continue. And then include anyone you'll claim as a tax dependent in 2024, even if they don't need health coverage. So will you claim any dependents? I'm going to go back a second because did I put 2? I'd put you were married, right? Okay. I did put married, right? Yes. Okay, thank you, everyone. It's been a long day. Been a long month. So include anyone. So we're not going to put kids on this one. I did see a funny meme today, the other day about a guy sitting at his kitchen table and talking to his wife and saying something like, I think we should decide not to have children. And then he says, we'll tell him tomorrow. It's cute. I didn't have it exactly right, but you get the gist. Okay, so tell us about you. So another little hint. I always recommend if you are enrolling for yourself and a spouse that you put the younger person first, okay? Have the policy in their name because it makes it a lot easier when you get to Medicare to take off the person that's eligible for Medicare than vice versa. It's just an easy, it's not impossible if you do it the other way. It's just easier because then you're just removing the person who's going on Medicare versus having to have the application redone in the non-Medicare person's name. So just a little hint there. All right, so let's do 62 male. So down here, you really want to read these and answer the question. Do any of them apply to you? Are you eligible for coverage through a job, Medicare or Medicaid? You know, legal parent of a guardian or guardian of a child under 19, pregnant. Don't include the baby as a dependent until it's born. Tobacco user, because sometimes people skip this and they're smokers. It really affects the rates. They're like 15% higher if you're a smoker. So they'll go through this and they'll get the price they think they're going to have. And then when they go put it in the cart and apply and have to answer on the application whether or not you smoke, and they get to the very end, they're like, wait, what happened to my rate? So you want to, you know, go through these and answer them accordingly. But we're going to say none of these. And let's put in a spouse. So we'll say 63. And let's play with a few things here. All right, so let's put in an income. Let's just put in 50,000. Oops. Well, went a little crazy on the zeros. So it's showing for this couple that at 50,000 of income, modified adjusted gross income, they're eligible for a premium tax credit of $1,328. That's how much the regular price of the plan would be reduced by. So if you're looking at a plan that's $1,528, they'd end up only paying $200 for it. Okay. So let's take a look at some of the plans and talk about plans. I'm going to skip this for now, but it's a way that you can kind of filter some of what you're doing. I want to show you everything. So yeah, right now this couple could actually get this plan from Better with a 0 premium, $14,000 deductible. So that's $7,000 per person. That's not $14,000 per person. And I'm just going to kind of mention some things as we go. You have to be careful. There's a little thing here that says add doctors and facilities. So if you want to look and see if your doctors participate with the plan, it will then show you on the screen, does not participate, participates, but I found it to be very unreliable. So you actually want to go to, I'm going to go to a different plan for a minute. I'm going to go by Better. All right, let's look at My Priority Health. This is a narrow network plan. So it's got like Beaumont, Corewell now. So you don't get your Henry Ford or U of M. It's a narrow network plan. But instead of putting in your doctors here, you just go to the plan details and at the bottom where it says, let's see. Okay, plan documents, provider directory. This is going to link you to the carrier site. So I'm not going to do it because it's going to take us out of here, but it would, like in this case, take you to Priority Health site where you can search doctors. The carrier sites are much more reliable than healthcare.gov. Because we've seen a lot of times where healthcare.gov says a doctor participates with a plan when they don't. So it could be that the doctor left the plan and the feeds are slow getting over to healthcare.gov, but I've seen it too many times to count. So that's a, you know.
So it doesn't make sense to just ask your doctor.
Sometimes.
Sometimes they.
But you want to talk to the biller.
Okay.
You want to talk to the person who's, doing the billing, because sometimes, like we've called doctors' offices before and they're like, you know, the person that answers, well, I don't know, let me look. And that's like concerning. We don't like, I don't know. So we found that the carrier directories are usually, you know, up to date and accurate. But of course, you can always confirm with your doctor. That would be, I would think, an extra measure to just make sure. All right, so we're going to go back. I'm trying to show you some things that cause problems, potential problems. Okay, so going back, so this is interesting. So here's this plan. It's $0 a month. But look at everything is after deductible. So. And that's for two people. So the deductible is really $72.50. If I'm dividing right tonight per person. But yeah, the only thing that's covered before deductible on this is preventive care. So let's, as far as carriers, like the biggest one in Michigan right now, as far as enrollment, is Priority Health. However, that may change next year because they're getting an average increase of 18.9%. Yeah, we're seeing some pretty big increases for next year, and theirs is the biggest. Now, last year they had a smaller increase, so I don't know if they're making up for it, but so we might see some shifting. Because people tend to think Blue Cross probably has the most enrollment. It's actually been Priority Health for a few years. But yeah, the biggest are Priority Health, Blue Cross. Blue Cross has PPOs and HMOs. Not many people are on the PPO anymore because it's just gotten so expensive. So really the probably 80% of people are on HMOs. Priority Health, Blue Cross is the only carrier that offers a PPO on the marketplace, okay? So all the other plans are gonna be HMOs. Some of the HMOs, like CAP, well, they're not on the marketplace, so I shouldn't say that. But like Priority Health's HMO, you don't have to get referrals to see specialists. So you do have to pick a primary care physician. But like what a lot of people don't like about HMOs is having to get that referral or permission from their primary care to see a specialist. So Priority is a little more user-friendly that way. Off marketplace, HAP, you've heard of HAP probably. They have PPO and HMO plans. With their HMO plans, you don't need referrals to see specialists. But Blue Care Network, so that's Blue Cross's HMO, they do require the referrals to see specialists. So these are just, little tips and hints. What we do is when somebody's approaching this space, we're going to take a list of your doctors. We're going to look and see what plans they participate with. People have extensive drug lists or expensive drugs. We're going to take a look and see if they're covered on a carrier's formulary. So we do a lot of homework, research going into it. Let's, what I didn't notice on this was if this couple was eligible for the cost sharing reduction. I did not see that pop up. So we're going to go back for a minute. So I want to show you what that looks like. But anyways, at that income for that couple, there's a lot of plans they can get for a 0 premium. If they wanted, let's stay here for just a minute. Add filters. And let's do silver. You can click over here at silver. Yeah, it didn't reduce the deductible. But you'll find with some of the silver plans, okay, like this one, they've got a $40 office visit copay before deductible, $80 specialist copay. It says from day one, just meaning you don't have to meet that deductible first. And they've got urgent care. And so for some people, they want a plan where they're going to be able to go to the doctors and just pay a predictable, smaller copay. So there are plans available like that. Usually pay a little more in premium. And I'm showing you here someone that's really getting a pretty large subsidy. But let's go back and let's see. I'm going to just try arrowing back here. And let's change the income. I want to show you some of the cost sharing reductions. Sorry, this mouse is a little. I'm sure it's me, not the mouse, but. All right, continue. Oh, there it goes. Do we see anything about cost sharing? Here we go. So at that income, it adds another pop-up box that says you may be eligible for extra savings if you pick a silver plan. In addition to the tax credit to lower your premium, it's also going to lower those deductibles and copays. So but you have to use a silver category plan. So let's filter on silver again for a minute. And they even tell you extra savings there. That easy pricing thing is new. I'm not sure. I don't think any of it's easy pricing, but so here we now have this plan a minute ago. Do you remember what the deductible was? It was a lot. Yeah. So now we've got a deductible of 1,000 instead. Yeah, and the copay went from 40 to 20. Specialist went down. So there are some sweet points where you can not only get lower premiums, but also lower out of pockets. If you got enough buckets of money to pull from different sources. Let's see what else. Now, some people will think that when their spouse goes on Medicare and there's only one person left on the plan, that they're going to save a lot in the premium. But what can happen is because there's only one person on the coverage and you're still looking at the household income, the subsidy goes down. So I've had couples this year where same, you know, what I'm describing, one went on Medicare and maybe they were paying $500 a month for the two of them on their premium. When the one went on Medicare, it went up to $600 for the one person. So it's all a calculation that they do. See, what else do I want to show you? But yeah, I think, you know, the important things are, and some of these plans that are coming up first, like Better, very small network plans. You really want to be careful that you're picking plans that the doctors you want to see participate with. Nothing worse than finding out you go to your doctor and you can't see them because they don't take your plan. Yeah. Let's go higher on the income. But you can really kind of see it without even doing it, because this plan here that's at that income, $35,062.88 a month without the subsidy would be $1,500, $1,531, and the deductible again would be a lot higher. So, any question? I know I'm not supposed to. Can I ask any questions on this piece of it? Okay. So again, it's important to look at your doctors. If you're on expensive prescriptions, are they on the plan's formulary? And where I showed you that you can look at doctors in the go to details. So in the same place, and it was the plan documents, you can look at the carrier formulary list of covered drugs. It does have, I'm not going to do it. Thanks. Thank you. Cancel. That's a good idea. That's what I want to do. There is a feature like where you can put your doctors in healthcare.gov, but I told you it's not real reliable. There's also a feature where you can put your drugs in, also not real reliable. But definitely recommend the carrier sites for those pieces. Let's see. Trying to think of some of the other places that people get tripped up. Sometimes they'll put in an income, and this is where it's good to see plans and prices first, because you might put an income in that puts you in the Medicaid space. So maybe the dividing line for that couple where I had 35,000, they still got a subsidy. And I'm not saying this is what it is, but maybe at 35,000 or 3,000 or 34,999, it might be Medicaid. So if you shop first, you know, you can, I'll show you this. So if you put in, I think it's around 27,000, that's going to kick it to Medicaid. And these numbers change a bit every year as far as, because it's based on federal poverty level. Oops, I did it again. See, maybe eligible through Medicaid. So most people don't want Medicaid as their carrier because you're very limited in the providers you can see. Although some people, you know, will go on Medicaid. So. All right, let's go back to our PowerPoint. See what's next. I want to talk about HSAs, but I'll wait till we get to that slide. Okay, how you use the premium tax. Right, so let's say you go through this calculation and you're eligible for $500 a month. You have the option to have it come off that premium each and every month. So it's going to reduce your monthly premium. And that fee goes to the carrier. So when the carrier bills you, they're billing you that, minus the subsidy. I've had a couple people, not many, where they'll only take a partial subsidy, like maybe they're eligible for 500, but they decide they only want to take 200 of that every month because they're not sure if they're going to end up going over the income that they've estimated. So they're just being a little conservative and careful, realizing that they can get that money back in their tax return if they were spot on. So I've only, again, had just a handful of situations. I've never had anybody do this where they're eligible for a subsidy and they take nothing up front and just wait to get it when they file their return. So I've never had anybody do that. But some people that are on the fence, where they're really close to not being eligible for a subsidy, they may be the ones that don't take anything up front. They may just wait. So if you're kind of right on that line and you don't want to have to pay something back, that would be a strategy to use that. So 3 options for how you apply that subsidy to your premium. Caution. So I didn't talk about this yet. On marketplace, off marketplace, I did talk about that. A lot of the plans are exactly the same. So sometimes people think the marketplace or the Obamacare plans are some different type of coverage or plan. Same plans for the most part are offered off marketplace. There's some, you might see a few plans on marketplace that are not on off and vice versa, but the vast majority are on both. But there are some plans that sometimes, like I had someone come to me once that they had already did their insurance and they enrolled on the marketplace. So over here on exchange on marketplace in the Priority Health at the time, 5,500 deductible plan. And they paid on exchange, they weren't subsidy eligible, $782. That same exact plan is available off marketplace at a lower premium. So they cost themselves, $100 a month by enrolling on marketplace in that plan. So there's all these little nuances and, areas to get tripped up. And, I
How
remember.
do you explore that in advance?
Well, you would have to look at carrier sites to get quotes on off marketplace. As agents, we're familiar with the plans that, have this nuance.
Reason to not.
Oh, heavens, no.
Yeah. And I asked the person, I'm like, well, because they enrolled on exchange, like in this plan, I'm like, well, did you roll on exchange because you thought you might be eligible for a subsidy? And they're like, oh, no way. I'm nowhere near being subsidy eligible. So it's like, well, they really should have just enrolled direct with Priority Health then and saved themselves $100 a month. So when this happens, it's typically in the silver medal plans that we see this. And it has to do with the availability of the cost sharing reductions. So the prices on the marketplace tend to be higher because of people that are eligible for those cost sharing reductions. Oh, and this doesn't really apply to you guys in this room, but if there's anybody listening to the recording, HAP and Priority Health, they continue to offer pre-reform plans where people could keep their coverage that they had prior to remember the whole thing, you can keep your plan if you like it? That really didn't play out, okay? A lot of people could not keep their plans. But Priority Health and HAP let individuals keep their plans that had enrolled before the Affordable Care Act, so they're called pre-reform, up until we just got notified a month ago that Priority and HAP are no longer letting people keep those pre-reform plans. So they are now going to have to enroll in a reform plan. They're not happy because they're going to be paying more for it. But yeah, again, none of you guys are already on individual plans. So am I out of time?
We're about 2 minutes.
Oh, good. We're making good, we are on track. So yeah, it really doesn't apply to you guys because you're not on these plans yet, but there are some people that are going to lose their plans, at the end of this year. Most people already lost them years ago. So open enrollment, this is the time when anybody can enroll that's eligible into insurance, whether it's on marketplace or off. And it's November 1st to January 15th. So somebody enrolls between November 1st and December 15th, they will get a January 1st effective date. If they do it between January 16th and, December 16th and January 15th, it would be a February 1st effective date. So outside of this open enrollment period, there are times when people can apply. It's called special enrollment periods. So certain life-changing events, you're working and you decide to retire in June, you're losing your employer coverage. That's a qualifying event to enroll in the middle of the year. You know, maybe you're getting divorced and you're losing your coverage, you know, that you had for your spouse. That's a qualifying event. So there are, you know, most of the time people are enrolling outside of the open enrollment period because they're losing employer-sponsored coverage. So, but if you're not, you know, if you don't have a qualifying life event, this is the time of year when anybody can enroll. It used to end December 15th, but for the past many years, they extended it to January 15th. It's like kind of like a little do-over for some people if they miss the boat, miss the deadline. So I kind of talked about the special enrollment periods. These are some of the qualifying life events that trigger that. Another one, sometimes you're moving to a new city outside of your planned service area. I want to talk about something else. That's a special qualifying event. COBRA. So you may be on COBRA, and sometimes people that are retiring pre-65, sometimes those COBRA rates, if you're not eligible for a subsidy, might be better than getting an individual plan, and your coverage might be better. So I always look at to see, well, do you have COBRA available? What's that rate? What's the coverage like? I've had some people actually plan on working till 63 and a half so that they got 18 months where they can take COBRA to bridge the gap to Medicare. So everybody's situation is really unique, you know, where you're coming from, your income, as to what might be the best solution. And in the individual health plan world, I look at it as like we're looking for the least worst. It's really what it's gotten to with these super high deductibles and their super high premiums, sadly. But I want to talk about COBRA, because if you start COBRA and want to get off and get a marketplace plan or an individual health plan, you can do it if it's during the open enrollment period. You can leave COBRA and get an individual plan. But let's say you're thinking, June, I don't like this anymore. I want to get an individual health plan. You can't do it then. So you either have to exhaust the COBRA, go the full 18 months, or enroll during the open enrollment period. You have 60 days from the loss of your coverage to enroll in an individual health plan, either on or off market. So if you have that qualifying life event, you can't just wait forever. You've got 60 days to do it. If you miss that window, then you have to wait till the open enrollment period. And I've just had some situations lately too, where people that didn't realize, you know, there was that deadline, and now they want to pick up coverage, and it's like, well, you're gonna have to go a few months without it because you missed the 60-day window. And there's really nothing else out there. Like, well, what else can I get? You know, is there a catastrophic plan? It's like, no, there's really not. There are some short-term plans, but they're medically underwritten, and they really exclude a lot of different coverage in the short-term plans. So I guess it's a worst case scenario having something rather than nothing if you medically qualify for it, but some people don't qualify for it because of health conditions. So there are some short-term plans. There is a new SEP that started, SEP means special enrollment period, but there's a new SEP that started back in 2022 that if your income doesn't exceed 150% of the federal poverty level, so you have to be high enough in income not to be Medicaid eligible, but not exceed 150%. If you are in that small window of people, you can enroll year-round into a marketplace plan. Okay, so it's not very many people, but it is out there, so I mention it. And that is set to go through 2025. We'll see if it gets extended. So I put this, I don't know if you can read this, but this is just what the health insurance increases were last year. And I got the next slide that show what they're going to be for 2025. These are averages. So when we see like at the top Alliance Health and Life, that is HAP's PPO plan. 14.8% last year. That's an average. So some people had higher increases than that. Some people had lower. Usually the older we are, the higher the increase we see. And these don't bake into the age-related increases. So premiums go up as you get older, their age hits. So when they say, okay, a plan's going up 10%, you might actually pay more than that because you're getting the birthday hit too. So But, you know, last year we had, I mean, I don't know if you can see this, but this range of increases last year, what I thought was interesting is Priority Health, and I mentioned this, they become the largest carrier for individual plans. They last year had a 5.2% increase. So it wasn't bad comparatively speaking. This year, 18.9. And HAP that had kind of a higher one last year, I think it was 14 something's 1.8. So when you're on an individual health plan, you do get a chance every fall to change your plan. And since there's no medical underwriting, you know, you really want to look from one year to the next to make sure that you're getting the best value you can for your money. You guys familiar with HSAs? Okay, I see some nodding. Yeah, okay. HSAs are great vehicles. So to have an HSA savings account, you have to also have a qualifying high deductible health plan. So there's two parts to it. In the high deductible health plan, the only thing that can be covered on it before deductible is preventive care. Okay, everything else has to be subject to deductible. There are some plans out there that have $9,400 deductibles and only preventive care is covered before, but the deductible is actually too high to qualify for an HSA. So that kind of was like a head scratcher for me. The deductible is too high for an HSA. So when you're looking at plans, they definitely identify in their name if they're an HSA eligible plan. So if you were to enroll in one of those plans, it would give you the opportunity to set up a separate HSA savings account. So there's banks, credit unions, you know, online custodians, lots of, you know, custodians for that HSA account. It allows you to set aside a chunk of money, and we'll go over the amounts. And what you put into that HSA is pre-tax. So if you're doing an individual plan, on the first page of your tax return, I have an HSA. There's a above, what they call above the line deduction for HSA, what you put into your HSA. The idea being that when you have medical expenses, you can dip into that HSA account and pay for them with pre-tax dollars instead of after tax. I've been building up like this treasure chest in my HSA that I want to use someday when I get to Medicare, because you can use it for Part B premiums. You can use it for COBRA premiums. So besides medical expenses, there are some premiums that you can use the HSA dollars for. But they're triple tax advantage because your contributions reduce your taxable income. And if you have it in an account that's earning interest or some allow investments, you're not going to pay taxes on those earnings. And when you take the money out, as long as you're using it for a qualified medical expense, you're not paying taxes then. So unlike an IRA where, you know, when you take it out, you're going to pay taxes. This is not like that. So I think they're, for some people, a great way to go about their health insurance, taking advantage of that HSA. So who's eligible? You must have an HSA qualified health plan, and you can't be enrolled in another non-HSA plan like through a spouse or parent. Can't be eligible for Medicare. So that's a big discussion we have next week at the Medicare meeting. Once you enroll in any part of Medicare, you're no longer able to contribute to an HSA. So if you're working past 65 and you decide to go on the employer's HSA plan, even though you could enroll in Part A at 65 of Medicare, you don't want to if you want to contribute to an HSA, because that then disqualifies you from doing so. So that's a conversation for another day, but
Quick question.
yeah.
My wife may end up going on Medicare soon.
Mhm.
I have an HSA account,
Is she still going to be covered on your health plan?
yes.
Then you can still contribute the family amount.
Okay.
Mhm. She cannot have her own HSA and put money, yeah. So you can still do the family as long as she's, that's a great question, as long as she continues to be covered on your group plan.
Sure.
Mhm. You can't be claimed as a independent. I think that should say dependent on someone else's tax return. Qualified distribution, so, you know, things that are going towards your deductible, you can use the HSA dollars for. Dental, vision. I mentioned COBRA premiums, long-term care premiums, even health insurance premiums, regular plans if you're receiving unemployment compensation. And it can be used for Medicare Part A. Most people don't have Part A premiums, but Part B premiums of Medicare, everybody has those. And Part D. So there are many ways to use those dollars. And let's say you get to 65 and you want to buy a boat. You got to be 65 to take it out of that HSA without penalty. You will pay taxes on it, but you won't be penalized at 65. So here's the contribution limits. So if you have an HSA plan in 2024 and you have family on the plan, you can put $8,300 in. There is a catch-up provision. So if you're 55 or older, you can put another 1,000 on top of that. My husband and I, so we have separate HSA. We're on the same health insurance plan, but we each open up our own HSA because then we can put 4150 and we can each put the $1,000 catch-up provision. So then we get 5250 times 2. What is that? 10,500? I don't know. It's another way we can get an extra $1,000 into it. So you each have your own accounts.
You're saying
Yes,
that
Chris?
it's actually 9,300 is what you could do this year.
Yeah, if you have one HSA account, one person's name,
Okay.
because they're not joint accounts, they're individual accounts. You could put the 9,300 in. If you had 2 separate accounts and you're both over 55, you could actually put in 10,300 between the 2. So, so you have to at least have a deductible this year, $1,600. That's the minimum deductible on the HSA. The maximum is $8,050, and that's why those $9,000, $9,500 plans, deductible plans don't qualify. Thank you. But you can see they keep raising the contributions. Like for next year now, we're going up to $8,550 a family, $4,300 an individual. So they do every year keep increasing what you can put into that HSA. Don't want to overfund it because then there's a 6% excess penalty. So don't put in more than the limits that the IRS tells us we can. Oh, guess what? Oops, I gotta back up. We're at the end.